Good morning, students. Yesterday we are discussed about hypoparathyroidism. That is in medical surgical nursing endocrine unit, 8th unit. Today we are going to discuss about hypoparathyroidism. Okay, what is hyperparathyroidism? There is the parathyroid glands secretes more PTH. It is called hyperparathyroidism. Okay, hypo. Already you know what is the meaning of hyper and hypo. Hyper means excessive, hypo means low levels. Okay, hyperparathyroidism. Deficiency of parathormone due to hyposecretion of parathyroid glands. Okay, serum in hyperparathyroidism, serum calcium levels and phosphorus levels are very high in blood, whereas in hypoparathyroidism the parathyroid glands that secretes this PTH hormone and deficiency may lead to hyposecretion of the parathyroid glands. Okay, here serum calcium levels are abnormally low, serum phosphate levels are abnormally high, and tetany may develop. Okay, very important one. Because of these parathyroid glands unable to secrete insufficient this PTH hormone, insufficient PTH hormone, it may lead to low levels of serum calcium in the blood and high levels of serum phosphate in the blood. Okay, it may lead to tetanus. The person may develop, if the person is having high levels of calcium, low levels of calcium and high levels of serum phosphate, they develop tetanus. Okay, incidence rate of hypoparathyroidism. Women are more prone than men. Incidence related to thyroid surgery. Okay, what is the incidence rate of this hypoparathyroidism? Compared to men, women are more prone to get this hypoparathyroidism. Then incidence rate is the person is undergone thyroid surgery, they will get hypoparathyroidism. This is about hypoparathyroidism. What is hypoparathyroidism means? Deficiency of the parathyroid gland secretes low level of PTH, or deficiency of PTH may lead to develop hypoparathyroidism. In hypoparathyroidism, in our blood there is a low serum calcium levels and high serum phosphate is there. Because of that reason we are getting tetanus. What is the incidence rate of this hypoparathyroidism means? Women are more prone to get hypothyroidism than men. Okay, what is the incidence rate? And the persons underwent thyroid surgery, they will get hypoparathyroidism. Then etiology or causes of hypoparathyroidism. Iatrogenic causes, that is treatment induced removal of viable parathyroid tissues. Already incidents, the persons undergone thyroid surgery, they may get hypoparathyroidism. Like this is also treatment induced removal of viable parathyroid tissues. Then surgery, accidental removal of during thyroidectomy. Okay, infarction of parathyroid glands because of an inadequate blood supply to the glands during surgery. Then trauma, idiopathic autoimmune disorders. Okay, this is the etiology and etiology or causes of hypoparathyroidism, like treatment induced removal of viable parathyroid tissues. Okay, surgery అంటే the patient is posted for thyroidectomy. During thyroidectomy, accidentally they will remove the parathyroid gland also. It may lead to hypoparathyroidism. Then infarction, you know difference between the infection and infarction. Infarction is lack of blood supply and oxygen supply to the particular part. Okay, infarction of parathyroid glands because of an inadequate blood supply to the glands during surgery. This is also the parathyroid may develop infarction because during the surgeries. Then trauma to the parathyroid glands. Then autoimmune disorders. Then assessment. How to assess the patient with the patient diagnosed as hypoparathyroidism. Okay. In assessment of history and physical examination. Okay, physical assessment, acute hypoparathyroidism. Okay, positive chavastic sign, that is spasms of facial muscle after a tap over the facial nerve, signifying facial nerve hyperirritability. Okay, in acute hypothyroidism when we are examining the patient and face, spasms may occur on during the examination. That is muscle after it, we will tap the muscle of the facial muscle. During tapping, the person may get facial nerve hyperirritability. But it is a positive chavastic sign, that is spasms of facial muscle after a tap over the facial nerve, signifying facial nerve hyperirritability. Okay. Then Trauze's signs, spasms of wrist and hand after compression. ఓకే, అసెస్మెంట్లో ఫిజికల్ అసెస్మెంట్లో ఏమవుతుంది, ఫిజికల్ అసెస్మెంట్లో టూ వీ హ్యావ్ టు చెక్, దట్ ఈజ్ వన్ ఈజ్ ఫేషియల్ మజిల్ ఒకటి హైపరిటబిలిటీ, ఒకటి వన్ మోర్ థింగ్ వచ్చేసి స్పాజమ్ ఆఫ్ రిస్ట్ అండ్ హ్యాండ్ ఆఫ్టర్ కంప్రెషన్. దీస్ బోత్ థింగ్స్ వీ హ్యావ్ టు అసెస్ ఇన్ ద పేషెంట్ డయాగ్నోస్డ్ విత్ hypoparathyroidism. Acute hyperparathyroidism lo positive chavastic sign, that is called spasms of facial muscle after a tap over the facial nerve, signifying facial nerve hyperirritability. And of these signs, that is spasm of wrist and hand after compression. This both we have to observe, or we have to do assessment of both these signs. Okay. Then one more thing, hypoparathyroidism assessment lo chronic hypoparathyroidism, acute lo two signs we have to assess, and in chronic hypoparathyroidism lo lethargy, weakness, fatigue, thin patchy hair, brittle nails, dry skin, personality changes, cataract emana unda, permanent brain damage is there, we have to assess. Okay, in chronic hypoparathyroidism what we have to assess means lethargy, patient is having any lethargy, weakness, the patient is performing any activities, always the patient is feeling any weakness, fatigue, and even some patients suffering with this hypoparathyroidism, even they are doing simple work also, they will make it fatigue. Thin patchy hair, the hair is very thin, patchy hair, very nice figure is here, thin and patchy hair. Then brittle nails, okay, figure is here, you observe this one, brittle nails. Then dry scaly skin, yes, personality changes, then cataract and permanent brain damage. Then diagnostic test, normal calcium levels first we have to know. In decreased serum calcium ante decreased 4.8 meter equivalents per liter, then increased serum phosphate 1.75, low parathyroid levels, decreased urine calcium. Hyperparathyroidism always the calcium levels are decreased and phosphate levels are increased. Okay, ophthalmic exam lo calcification of lens, because radiograph lo increased bone density of the skull. Okay, very important one. Assessment diagnostic test lo ఏమవుతుంది, decrease the serum calcium levels and increase the serum phosphate levels, low parathyroid levels, that is PTH hormone levels, decrease the urine calcium levels. And ophthalmic examination, calcification of the lens. Radiographic examination lo increased bone density of the skull. And then what is the management of hypoparathyroidism means active form of vitamin D to maintain calcium. Then drugs like rocantrol, hydrochloride, dihydrotestosterol, IV calcium, these drugs you write in notes and read in medical surgical nursing textbook. At that time only you will understand about these drugs, but these names are very rare we are hearing, but all common drugs like propranolol, atenolol, then diclofenac, ampicillin, like that you know very well, but these drugs names are very new to you people. Because of that reason you read in medical surgical nursing textbook, you open your textbook and read once again. Okay, IV calcium, One is, it is a vitamin D supplementation is important. One more thing, IV calcium, because low calcium levels. Because of that reason, we are giving IV intravenous calcium. That is 10% calcium chloride or calcium gluconate. That is, and this is the emergency treatment. Because of low calcium levels and high phosphorus levels, the person is getting tetanus or tetany of the muscles and spasms also. Because of that one, we are giving intravenous calcium. It is emergency treatment. 10% calcium chloride or calcium gluconate. Then supplemental calcium, oral calcium, dietary supplementers are very, very important. You write dietary supplement of calcium assignment and you submit evening without fail. All students. This is assignment for all 90 students, not for 60 students, 68 students. Calcium supplement diet. First of all, we have to know what is the diet containing calcium. Okay, without knowing anything, we cannot explain the patient what is the diet containing calcium levels. Okay, you write assignment, calcium supplementation diet. Okay, oral calcium, dietary calcium, address seizures and laryngeal spasms. That is, if the person is having laryngeal spasms, calcium gluconate and tracheostomy is important. Parathyroid hormone replacement. By in hypoparathyroidism, the patient may need tracheostomy, means the complication of this hypoparathyroidism is tetanus. Because of tetanus, laryngeal spasm is there. Because of laryngeal spasm, the patient is unable to get oxygen and unable to the secretions are collect in the lungs, and the patient is unable to remove that secretions or express that secretions. Because of that, tracheostomy is important in the patient is suffering with laryngeal spasms, seizures and tetanus. Okay, parathyroid hormone replacement. In hypoparathyroidism, the replaced by ultrasonic treatment for lifelong they have to take. But like this parathyroidism also, hormonal replacement is very, very important. This is about hypoparathyroidism medical management. That is active form of vitamin D, like procaltrol, hytacrol, that's a dihydrotestosterone. Then IV calcium, 10% calcium chloride or calcium gluconate. Then emergency treatment, supplemental calcium like oral dietary. The dietary management is very, very important. We are taking the sufficient diet in calcium, we cannot get parathyroid disorders. Okay. Seizures and laryngeal spasm. If the patient is having seizures and laryngeal spasm, they may go to tracheostomy and calcium gluconate supplementation. Then another important one is parathyroid hormone replacement. Okay, very, very important one. You are writing definition, causes, pathophysiology, medical management and surgical management, but we are neglecting about the nursing management. Okay. Okay, nursing management is very, very important. In nursing management, history taking and physical examination is common. Okay, this is about nursing diagnosis. And before framing nursing diagnosis, clinical manifestations and assessment are very, very important. Based on clinical manifestations and assessment, we are framing this nursing diagnosis. Okay, knowledge deficit of dietary management and medications. Okay, first of all, we have to know what is the diet containing calcium. Okay, for this one, the person is having knowledge deficit of dietary management or medications. Okay, what we have to do after framing this knowledge deficit and high calcium, low phosphate. Avoid milk and cheese, because this milk and cheese contains high in phosphorus. Already in hypoparathyroidism there is a high phosphorus level. Again we are introducing more phosphorus levels. Because of that one, avoid if the person is diagnosed with hypoparathyroidism, we have to explain them, avoid milk and cheese. Then calcium rich food, yes, beans, almonds, 7 dark green leafy vegetables like spinach. Okay, calcium rich foods ఏమున్నాయి? beans, almonds, 7 dark green leafy vegetables like spinach. Example, discuss medications and ensure compliance with the treatment. Without discuss with the patient, we don't know what problems they are having, if they are having sufficient knowledge about medications or not, when they have to take medications, at what time they have to take medications, if they are not taking medications, what are the problems with that one, we have to explain. This is about knowledge deficit of dietary management or medications like high calcium, low phosphate, avoid milk and cheese, calcium rich foods like beans, almonds, 7 dark green leaf vegetables like example spinach. But 7 dark green leaf vegetables, you write what are the 7 dark green leaf vegetables having this calcium. Then discuss with the patient and their caregivers about medications. Then high risk for injury, muscle tetany related to hypocalcemia. High risk for injury, there is hypocalcemia and easy to the bones will get easy to break. Because of that one, high risk for injury is the diagnosis. Because muscle tetany is there, because of muscle tetany they will easily get hypocalcemia. Then assess signs, already facial sign and bone sign, both we have to assess for twitching, numbness and tingling. Then seizures, because of seizures they will get accidents, injuries, tongue bite. Then aspirations, because of that aspiration they will may go into choking, and aspirations are very dangerous. Because of the respiratory distress and respiratory arrest may get, if we are not give care in proper time, and the death may occur. Because of that reason, if the patient is having seizures, we have to take care. Okay, safety precautions for seizures. What are the safety precautions for seizures? If the patient is diagnosed with the seizures, we have to keep railing cords are very very important. If the caregiver is there, caregiver is not there, we are providing this railing cords, means we can avoid the fall downs. Yes, because of that reason safety precautions are important. If the patient is not conscious, if the patient is conscious and at the same time they are having seizures, means we have to keep the oral airway, because to prevent this aspirations, and at the same time we can prevent the tongue bite, and at the same time we have to remove that secretions very easily with the help of airway. Okay, already here this point is there. Maintain patent airway is very very important. If airway is there, we cannot maintain the patency. What is the problem? Again, the blockage of this airway may get respiratory distress, collection of secretions in the lungs. Again, the patient may get respiratory distress, and then lack of oxygen supply, saturation levels are very low, and again the patient death may will occur. If the patient is having airway, maintenance of patent airway is very very important. Okay, keep trash set at the bedside. Keep ampoule of intravenous calcium at bedside. Yes, calcium glucosinate is a emergency drug. Because of in this the person is having low calcium levels and high phosphorus levels. This is about high risk for injury, that is muscle tetany related to hypocalcemia. Assess the facial signs and bone signs. Assess for twitching, numbness and tingling, seizures, Chevostek sign and transient signs. That is called Chevostek signs, and it is a facial sign. This sign is called bone sign. Safety precautions for seizures: maintain patent airway, keep transit at bedside, keep ampoule of intravenous calcium gluconate at bedside. Okay, this is about hypothyroidism. Hyperparathyroidism and hypoparathyroidism is over. You write assignment on differences between hyperparathyroidism and hypoparathyroidism, and assignment on diet that containing calcium without fail, and you submit on evening. Okay, if you have any doubts, you ask me and call me. But nobody is. Yesterday, the students have given only 68 students have given attendance. But our class strength is 90 students. But nobody is giving attendance. Okay. If you are not give any attendance, we will give internal marks for only the students, those who are observe these videos and listen these videos. Okay, thank you. And once again, you write assignment on differences between hypoparathyroidism and hyperparathyroidism and the diet containing calcium. Okay, thank you.